Doug Ford is in Ottawa with Canada's premiers to hash out a new healthcare funding deal with the Prime Minister. Justin Trudeau came to the table today with a pool of cash that Premier Ford is calling a start, but not enough. It includes an immediate top-up of $2 billion to the Canada Health Transfer with no strings attached to address a struggling system. Ahead of the sit-down, Ford signaled he wants any increased funding to be permanent.
This is about certainty and sustainability. It's about building a health care system across this country, not for 5 years, not for 10 years, but for decades to come.
The Prime Minister is offering an increase of $196 billion over the next 10 years. Only about 1/4 of that is new money.
That's money that we need now.
The association representing Ontario's doctors says health transfer payments, which are made on a per capita basis, have not been keeping pace with patient needs. There are currently 206,000 Ontarians waiting for surgery. At our hospitals, expect a wait of more than 20 hours in the emergency room before getting a bed in a ward. And the ballooning backlogs are coming at a time when frontline workers say they're burnt out and quitting in droves.
It's not so much about the number, what we need. It is about where we need the investment. We need investment in primary care. 1.5 million Ontarians don't have a family doctor, long-term home care, community care, and our mental health and addictions strategy needs to be better for our patients.
You could argue that the increase in spending that we're seeing in healthcare has not really been met with an increase in the transfer over time.
This professor of health policy says while the transfer has been relatively stable, it alone does not demonstrate the federal-provincial division of spending.
When you look at other spending the federal government has made towards healthcare, like with the pandemic and with other targeted investments, you'd have to really account for all of them.
While the federal government is asking for healthcare data, under this proposal, the money is not attached to meeting any targets. Now, nothing's set in stone. The premiers say they'll meet again in the coming days to go over the details.